This talk is about the CIPHUR collaborative, which was an international effort to determine which topical antiseptic was most effective and safe for upper limb surgery. Throughout 2021, hundreds of surgeons in 42 hospitals across 13 countries recruited nearly 2,500 patients. Those were adults and children. They were having surgery to the upper limb. They captured prospectively the risk of surgical site infection. We also captured information on adverse events related to the topical antiseptics. As this plot shows, most surgeons are not adhering to international guidance. Whilst an increasing proportion are using alcoholic chlorhexidine antiseptic, the majority of surgeons are using other antiseptics like chlorhexidine in water or povidone-iodine in different solvents. And importantly, there is a minority that are using no antiseptic at all, or alcohol alone, or indeed cocktails. And within these different antiseptics, there is substantial heterogeneity of concentration. This must be resolved because it's having an important impact on the risk of infection for our patients. Here we see the data for elective upper limb surgery only. It's a Kaplan-Meier plot. At the bottom is everybody. They have no infection and we start their observation. We observe them for 3 months, 90 days. Surgeons who prepped their patients with alcoholic chlorhexidine, shown in yellow, conferred a risk of SSI of around 1%. Patients who were prepped with other antiseptics, like povidone-iodine in alcohol or water, had a higher risk of infection, around 3%. And something else we observed was alcoholic chlorhexidine was delaying as well as minimizing the risk of infection. Here, the first patient didn't develop SSI until over 2 weeks postoperatively, compared to the other group who are developing their infections within just a few days. This is in agreement with the wider literature. And importantly, we also busted the myth that alcoholic chlorhexidine is dangerous in upper limb surgery because just as in other studies in other areas of the body shown, there were no ignition fires, no burns beneath tourniquets, and no contact dermatitis. Changing practice will have significant ramifications for surgeons around the world, but just in the UK, consider these 4 elective hand operations that we do. That's carpal tunnel decompression, cubital tunnel decompression, Dupotrons, and trigger release. In the UK, we do around 120,000 of these every year. And if all of you who don't use ChloraPrep swapped to it, then at least 1,500 patients would be spared an infection every year, and that would save the NHS at least £677,000 annually. If you'd like to know more, then the CIPHUR collaborative paper is published in the British Journal of Surgery. All of the data is available open source via the Open Science Framework, and you can always sign up to the RSTN to follow project updates and/or get involved with the next iteration of CIPHUR.